Hi, we're here today with Joanne and we're going to be doing the Plexr Semi-Ablative cat resurfacing, often known as cat scratching. We're using the 0.7 handpiece, which is the white one, and it's in a fractionated mode. We're going to be using the straight regular tip with this. I'm going to get this set up. See you in a minute. In order to get prepared for our cat resurfacing treatment, we're going to set the handpiece into a fractionated mode. The majority of you are using a constant and continuous mode on your devices when you're doing the the fully ablative treatments. So I'm going to be using the 0.7 white handpiece for our semi-ablative or cat scratching device. I'm tapping it on the screen. You'll see it brings up this screen which will run this handpiece. This is a bit of an older version of our Plexr device. It's one of the original Plexr devices. On your screen with the newer devices, you have a constant and fractionated button here. But our fractional button is right here. And I have changed it to it's a 50 time on and 50 time off, meaning milliseconds while the device is turned on and milliseconds while the device is turned off. If I pick up the device now and I push the button, you'll see it looks like a bit of a strobe light. That's your 50-50 in fractionated mode. We are able to put our tip in and start our treatment now. So Joanne has had some BLT numbing on for approximately 30 minutes. We're going to do the cat resurfacing through her neck, around her nasal folds and upper lip for those barcode lines. I'm going to remove some of the numbing in an area that we're going to work. I'm going to leave the numbing on to the other side of the area so that it can continue to numb. Just wiping this off. And I'm going to use some stanhexidine 2% in the area to cleanse, sterilize the area from the freezing, numbing. Joanne's probably not going to feel very much today. There is not a lot of, it's not really even uncomfortable. The numbing helps quite a bit. So as you notice, the light is flashing 50 milliseconds on and 50 milliseconds off. It's almost like a little disco ball. And what we're going to do is we're going to hold the device at a 45-degree angle and we're going to drag, draw, glide across the surface of the skin. What do you feel right now, Joanne?
I feel like I have a cat on my face.
There you are. It is...
It doesn't hurt at all.
No, this gentle draw, you don't want to see the skin indent or divot too much. You're just going to move along. As I said, we're going to do sections in a 2x2 sort of manner so you can keep track of where you've been on your treatment. Every once in a while you will see, excuse me, a plume of smoke because we are still sublimating skin. We're just not sublimating in the manner of a full ablation. And you just continue on through the whole area, doing the draw across the neck. In any areas that you have a deeper rhytide, you can, if you chose, go back and forth across that rhytide. And what that's going to do is we're going to soften the ledge. So the rhytide is not so deep, it's more of a softened. And tomorrow we will see, you'll notice she has sort of concentrated zigzagging motion through this rhytide. You might want to come back and do a second pass, different direction. So there's a hashtag. Ultimately, it's a hashtag, what do you want to call that? Number sign, whatever you want to call it, that is the action in which we are going to do. We also pick up pigment with this device when we do cat resurfacing or cat scratching. You'll notice the tip actually starts to pick up some pigment from the skin. Bonus, picking up some of the sun damage. You won't notice where you've been. It's very important that you keep track mentally, and that's why I do the 2x2 grid, so that I know where I have been and where I'm moving to next, so that I can make sure that my pattern is even and all of the area has been treated. Don't move too fast, and you'll notice that I need to just wipe the tip of my device. There is some accumulation of sun damage, sublimated tissue. I'm going to turn the device back on. That's been 3 minutes. And we just moved over to the center of the neck. Again, we're just working on this deeper right side. I'm going back and forth in the valley of it over a bit of a zigzag over the entire right side. Can do different angles, obviously. I am using a 2x2 sort of square to follow my pattern. You do not want to see the skin depressed very much. You want to gently draw, drag, glide over the skin like this. The tighter the hashtag, obviously, the tighter the pattern, the longer the healing, the more sublimation intensity of the device or the treatment. As you see, I'm just drawing across the skin. I've created my hashtag in a 2x2 area. Going to move up a little bit more, and we're going to go to here. I noticed I missed a spot. Like that. Did you see that little plume of smoke? We're still sublimating. Joanne, if you could tilt your head, just tilt it towards me. Thank you. I'm going to work in this section here. Again, I'm going to draw my grid pattern. You can see the little plume of smoke. Sublimation, it's not smoke, we're sublimating skin. Don't go too fast. Allow the process of the sublimation to take place, which is when the ions in the atmosphere create a plasmic arc. The ions will sublimate the skin. That plasmic arc sublimates skin. So although we are touching the skin, every time we lift up or there's a misconnect with the skin, when we're off the skin just slightly, you will see the ions in the atmosphere creating that plasmic arc. That plasmic arc is sublimating skin. You want to pull the skin taut and just gently draw across the skin. So I'm just about finished Joanne's neck. I will show you the other side. There is some slight erythema, a little bit of discoloration in the areas that had some sun damage that I concentrated on. This is a lovely segue treatment. Plexr shower and cat resurfacing is a lovely segue treatment into a more of a resurfacing or the Plexr Ablative. If you have a client that has never had treatments done, this is probably a treatment that they will embrace and not feel so inundated or stressed by, because the healing journey is very manageable. We're going to talk about what that healing journey is after. It's very similar to the Plexr shower. As you notice, I'm just again going into the deeper right sides, a little bit of a zigzag. I'll zigzag in a different direction now. Just want to soften them slightly. What can Joanne expect? It's a lovely, is a good question from her treatment. So we're going to apply after treatment our Actofil serums. For Joanne, I'm going to apply the Acto Reverse, and I may do a second pass of the Acto Firm or Lift. This will peptides, CD44 receptor. It'll all work together in helping her healing journey to speed, and that the vital cell growth will be stronger and more effective from the treatment. We're doing a bit of a reorganizing of collagen. Obviously, we're creating a trauma. Traumas always lead to new cell growth, and that's what we're working for here. We want to create a more smoother texture to Joanne's neck, and I want to help address some of the sun damage. It's a very easy treatment. Joanne, how did you feel through the treatment?
Oh, it was absolutely fine. It was no pain, not painful at all.
Awesome.
It was great. I guess I would have to stay out of this direct sunlight for a few
Correct.
days.
Yeah. No sun tanning for approximately 2 weeks, but you know, that I don't see you out wearing any bikinis anytime soon.
No, you never know.
So now that we have cat resurfaced Joanne's neck, if you we'll have in a minute, you'll be able to see it's just slightly pink. It's nothing too severe. We're going to resurface her perioral area. It's in a lot of questions have come to me about the nasal folds and the barcode lines, so I thought it would be a great chance to show you up close. So if you notice the area that we have treated, there's a bit of discoloration where we might have picked up some sun damage. There is some aggressive areas that are showing through. There's a pinkness to the skin, the erythema. Obviously the blood has come to help heal the area. This may become pinker, if that's a lack of a better word, but there may be more redness in the skin as the day goes on. But by tomorrow, within 24 hours, her skin should go back to fairly normal with these sort of little injury points, which will turn to slight scabs. And we are going to do this nasal fold and the barcode lines for Joanne. This is a semi-ablative treatment, so obviously we're going to need more than one treatment, but we're going to just draw gently across the surface of the skin. You see that sublimation happening? We're still sublimating slightly. And I'll draw through that right eye as well, and this way. And then we're going to go back in a separate direction, obviously. See that slight plume of smoke. You won't always get that slight plume, but sometimes. And it's just going to soften, as we call them, the hills. Take the height to meet the low. I'm going to take this section here and I'm going to create, see the debris that we've picked up. That's some sun damage, actually. It's good to wipe your tip often. I'm going to come through here and I'm going to, and if you notice, my device is in a 45-degree angle, not 90. It allows for an easier glide on the skin. And through her deeper right eyes here, I'm just going to go a little bit extra. Get that upper lip resurfaced. Gently. So 2 of these semi-ablative treatments could give almost an ablative result. Depends on where we're starting and where we're stopping, obviously, in our turning back the clock. So we have finished our cat resurfacing on Joanne's neck and perioral area. Now we're going to apply our serums. We're actually going to apply the Actofil biostimulant. I'm going to use the reverse and firm serum in the different areas. I'm going to use the reverse obviously in areas that I wish to reverse sun damage and some of the deeper rhytides through the upper lip. And I'm going to use the firm on her neck. It's always, everything's adaptable for the client. It's up to you. We're going to use 1 mil on her neck. I'm applying, these are clean gloves, obviously. And I'm applying in a tapping sort of motion. I do not need to be rubbing and scrubbing. Ask you to just turn your head some, thank you. Depending on, maybe the client needs 2 mils, you'll work that into the price, obviously, of your treatment. If you want to send them home with the mil of the product, that's also a possibility. So we've just finished Joanne's cat resurfacing on her neck and perioral area. We've applied some Actifil serum. It's a biostimulator to help with the results. Obviously, it'll help the healing journey as well as create a much better result from our treatment. Anything that you apply topically will obviously create a better end result. So Joanne, why don't you tell us about it?
Well, it was absolutely painless for one thing. I thought it was going to be like elastic, like boing, boing, but it wasn't. It was very good. It feels like, right now, it feels like I've spent my first day at Punta Cana without the expense of going there.
Yeah,
That's
there you
what it
go,
feels
little
like.
sunburn driving home from the beach. That's my famous saying. Joanne, I'll let you have a look at yourself. See, you'll notice there's a bit of redness, obviously. And tonight, when you go home, you can apply, I'm going to give her a little bit of an aquaphor so that she can apply a light, thin layer over the area in which we've treated. That will just help for hydration, environmental dehydration. And,
I want to see me again.
right,
Yeah.
you really don't
Hardly
look like
recognize
looks like hardly nothing's been done.
Yeah.
Great.
That's great.
Thank you. That's been our Plexr Plus cat resurfacing.